Dr. Brown, this next topic I'm going to bring up is a little controversial. Vaping and lung disease. What your lungs are trying to tell you. I've heard that vaping from some people, their argument is that vaping is safer than cigarettes. What does vaping actually do to the lungs? And is that a claim that is true?
I will say, I tell my patients who use vape or try to use vape to get off of cigarettes, it is not safer than smoking cigarettes. It took 50 plus years to determine all of the things in cigarettes that are bad for the lungs. Vaping has not been around that long, but we do know that it can cause permanent lung damage. Unlike tobacco or cigarette smoking, which can take decades before we notice the damage in lungs, vaping can cause damage in as little as 1 year of usage. You do notice symptoms that vaping is hurting your lungs with coughing, wheezing, issues with not being able to be as active as you normally are within about 3 days of using vapes.
3 days.
3 days.
Oh,
So
wow.
it's accelerated because there's lots of chemicals
Yeah.
that unfortunately can cause cancer as well as COPD in vapes because it's flavored, and because it's, I guess, marketed more palatable. It seems
Right.
like it's a benign method of getting your
Well, it
nicotine.
tastes like cotton candy. It can't be bad.
Yes, and it smells like cotton candy and smoke. But vapes themselves, because it's heated, it accelerates the damage and the chemical reaction that you're inhaling into your lungs.
Hmm.
Because there's oils that are used to add all those lovely smells and flavors. It can coat the inside of your lungs and reduce the function. Our lungs prefer nice, clean, fresh air, and oils cause the little hairs in our lungs to lay down. And we actually need those hairs called cilia to get
Yeah.
toxins, mucus, bad things out of our lungs. And when we vape, we potentially reduce them to inactive. So vaping, we know, has caused severe respiratory failure in young people who are normally healthy. We saw that in 2019. I was working in the ICU, and we had lots of cases of healthy 18, 19, 20-year-olds that ended up on life support or ventilators because their
Yeah.
lungs didn't work. At first, we didn't understand what was going on, thought maybe it was part of an infection, but there was no virus, there was no disease. The only causative action is that all of these individuals vaped. Those that survived the illness, of course, swore off and began to preach to their friends. But we do know now in 2026 that we have 11 and 12-year-olds that are vaping.
Oh, it's just hard.